Hi, I'm Dr. Somnath. I'm the Medical Director and the Head of Anesthesia and Critical Care at Prakriya Hospitals. As a critical care physician, one of the biggest problems that we face is that patients present too late to hospital. Someone presents too late to hospital, their likelihood of having a worse outcome is extremely high. And this is commonly known among all clinicians that patients presenting late have worse outcomes. To give you an example, we had a middle-aged woman who presented to our hospital about 3 years ago, and she had fever with shortness of breath for 3 days. When she presented to the hospital, she was extremely sick. We tried our level best in the emergency department and the ICU to the point where we even tried to give her oxygen through the veins into her blood directly using ECMO. But within 8 hours from the time of presentation to the ER, she passed away. This is rather unfortunate that despite having shortness of breath for 3 days, she waited that long to come to a hospital. That left us thinking, could this lady have survived if she had presented to the hospital? We therefore looked to find a way by which we could tell people, that guide people as to be able to identify warning signs that would help them identify when it is time that they need to present to a hospital. So we have designed a poster which helps identify warning signs, and this can be used by the general public, either by the patient who is unwell or by families of the person who is unwell, and guide them to reach hospital early. Now the acronym that we have used is A, B, C, D, E and F. So A stands for alertness, or any alteration in someone's alertness. Anyone with any kind of alteration in their alertness, this could happen to anybody. This can happen either from infections or could happen from other problems that are affecting other parts of the body, for example, your kidneys or liver. And the alertness is change in alertness from an infection is very common among children and senior citizens. The other common problem that affects alertness is, or the brain function, is seizures. Now, anybody with either new onset seizures or somebody who has seizures having new onset seizures again should present to the hospital. The other common problem that affects the brain is a stroke, and the acronym that is used by the Stroke Association to guide patients to reach hospital is B FAST, which is BEFAST. Now B there stands for any change in the balance of the patient. E stands for any signs where there is a drooping of the eyes or they have double vision or anything else. F is when they have any kind of movement abnormality on the face where either one side of the face is not moving, or they have lack of movement on one of the arms or the leg. The other thing is S stands for any speech disturbance. With any of these, it's time for them to be brought to the hospital. So this kind of summarizes all the A warning signs which are required, which people should look out for before they bring the patient to the hospital. The next one is the B warning signs. And the B warning signs are, the B stands for breathing and says that there is a problem with your breathing system or your lungs. So with the B signs, anybody who's significantly breathless and has never been breathless like that before, any unusual breathlessness, whether this is unusual breathlessness to normal activity or something that they are accustomed to, they should seek medical help. The other problem is anybody who's breathless while lying down and then they get better when they sit up. So this is another sign that there is a problem where it's likely that your lungs are filling up with water. The other common problems with breathlessness is Either your breathing rate is too fast or too slow. Now, if your breathing rate is more than 28 breaths per minute, 26 to 28 breaths per minute, you must seek medical help. It means that your lungs are not able to oxygenate the blood properly. Actually, a breathing rate of less than 10 or even 10 breaths per minute is ominous. Anybody with a breath rate of less than 10 breaths per minute should reach the hospital. Anybody with severe persistent cough that is not settling down after 1 or 2 days with adequate medication, or if they have any blood coming out while they are coughing, should get to the hospital. The next set of warning signs, called the C warning signs, the C stands for cardiac or for the chest, and the most important one in that is chest pain. We regularly see about 1 to 2 young patients below the age of 55 brought dead to the hospital every month, having had chest pain the previous night. They confuse this chest pain with gastric, and that is one of the biggest problems that people have. We confuse our chest pain with gastric. Typical chest pain from cardiac cause is in the breastbone or behind the breastbone, in the center or slightly to the left. The pain may be referred or may be seen in the left shoulder, in the jaw, in the neck, or in the left arm, or it may go to the back, and it's typically crushing and central in location. If you have this kind of pain and have never had pain like this before, you must get to the hospital, especially if the pain is for more than 10 to 15 minutes. There is absolutely no doubt. It's much easier to come to the hospital, get an ECG done, get a couple of blood tests done, make sure things are okay, right, rather than think that this is gastric. The other things that you can have with the C warning signs are if your BP is extremely high. Now, it is important that anybody who is at risk, now anybody in your family has hypertension, or if you are a known hypertensive on medication, you should check your BP regularly. And if your BP is unusually high, yes, an increase in your systolic by about 20 to 30 or your diastolic by about 10, you must present to the hospital. The other thing is an increase in your heart rate. If you're having palpitations, you're feeling uneasy in the chest, or you are having an increase in your heart rate. Now, majority of the people after COVID will have a pulse oximeter at home, and you can use a pulse oximeter to measure your heart rate. And if your heart rate is either too fast, which is heart rate of more than 100 per minute when you're resting, or your heart rate is too slow, less than 60 beats per minute, then you should go to a hospital. The next set of warning signs are the D warning signs, where D stands for dehydration. Dehydration is commonly seen in people who are not either eating or drinking much, and this could be from tiredness, fever. The other most common reason for dehydration is patients who are having, or people who are having, significant number of episodes of diarrhea or vomiting, and they do not replace fluids adequately. When someone's dehydrated, the earliest sign of severe dehydration is an increase in the color of the urine, and the urine becomes more and more dark, and a decrease in the volume of the urine. And this, if not looked into immediately, and if they do not present to hospital, can get to the point where your kidneys get significantly affected. Next set of warning signs are the F warning signs, and here F stands for fever. Now, if you have very high grade fever that's not settling down, say with a few doses of paracetamol or medication that your doctor has prescribed, and any of the other signs, which could be signs of dehydration, could be signs of loss of or decrease in consciousness, or your heart rate or BP is low, then these are times when you should get to the hospital. The next warning sign are the E warning sign, which is extreme exhaustion. Anyone having fever with severe tiredness, inability to do anything, inability to eat, and they're not taking enough or have severe body ache and severe joint pains, these are generally an indication for someone to get to the hospital. Among critical care physicians, extreme exhaustion with severe body ache is considered an extreme poor prognosis, and most often these patients will turn up late to hospital and will have a poor outcome. So the extreme exhaustion is an important sign of what we call systemic infection, and which we call as sepsis. Plea that I would make to everyone is, when you are unwell, look out for the warning signs. We have designed this poster that uses the algorithm or the acronym of ABCDEF. Look out for these warning signs. If any of the warning signs are present, please either come to the hospital yourself or bring your relative to the hospital immediately if they are unwell. Thank you.